afternoon, everyone. We will get started in just a few minutes to let everyone get signed on. Good afternoon, everyone. I'm Amy Bonsall from the Association of Food and Drug Officials, and we would like to thank you for joining us for the AFTO Professional Development Series. We are here today with Robert Mancini to discuss learning and behavior-based food safety training. Rob Mancini has vast experience and knowledge in the field of food safety with a specific emphasis on alternate modes of food safety training and behavior science. Rob has more than 20 years experience in regulatory compliance and as a certified public health inspector. In Canada, he provided expert advice on revisions made to the Canadian Food, Retail, and Food Services Code and federal, provincial, and territorial national guidelines for food safety training. Rob hosted and provided research on the television series Kitchen Crimes for Food Network Canada, HGTV US, and Discovery Asia. He has provided expert opinion on food safety for varying levels of government in Canada and is an active speaker on food safety and an author of a BARF blog. He currently holds a master's degree in food safety through the Kansas State. We will be taking questions at the end, so please feel free to hold on to your questions or type them in the question box during the presentation, and we will read them out at the end. We will also be opening up the phone lines and allowing people with their hand raised to ask their own questions. Rob, you can take it away.
Great. Thank you, Amy. I appreciate it. And hello, everyone, and thanks for taking time out of your busy schedules to attend this webinar. I'd also like to give a big thank you to AFTO for giving me the opportunity to present on this topic. And one big final thank you to Amy, who's behind the scenes organizing and orchestrating everything here, because in the event my PowerPoint goes down or something happens, she's going to be there to save me. So thanks, everyone. I appreciate it. I trust everyone is safe and healthy. I know we're going through some crazy times right now. I'm currently working from home. And should you hear in the background, by the way, what may sound like gunshots, please don't be alarmed. It's simply my 4-year-old son who finds it amusing to open the door to my office every once in a while and shoot me with his Nerf gun, as you can see here in the picture here. And there's the 9-year-old with the boxing gloves. So the knowledge was there when I actually told him, hey, listen, this really hurts, and I'm trying to work and I'm trying to, do Skype calls and so on. So perhaps we can stop that. The knowledge was there, but the behavior didn't seem to alter at all, which is why I'm here today and which is why I want to discuss a few things. He did change his tune a little bit when I did mention I'm going to buy him ice cream as soon as I was done. That may be a poor father, but behavioral science, it seems to work well. So once upon a time, even before I got into this whole field of training, I remember how distraught my mother was. My mother, folks, by the way, she's from Italy, and English is her second language. And she arrived to Canada. She worked for a restaurant, and she was required to take the traditional food safe course, the 8-hour PowerPoint course. And I remember how distraught she was when she got home, because if she didn't pass the course, there was always that possibility where she can get fired, right? And she's raising 3 kids and 3 Italian boys yet too. So you can only imagine how much money went into that. But aside from that, I remember asking, well, what was so wrong with the course? What happened? Why was it so overwhelming and so on? And my mother's a very bright person, and she told me how it went. It was PowerPoint literally all day, very monotonous. It was too long, way too long. It was boring. It was complicated. And unfortunately, well, especially I'm actually calling in from Canada right now. And in Canada, specific in Manitoba, anyone can teach a food safe course. You don't need to be a certified health inspector. You don't need to be an expert in food safety. You don't need to have any background in food safety. Unfortunately, this instructor had very minimal background in food safety. And so the stories weren't there. It wasn't compelling. It wasn't interesting. Not as if, for instance, a health inspector, which we call them in Canada, or a sanitarian in the States, would actually administer that course. So I said, okay, well, we need to do something. So I decided to embark my graduate work with Doug Powell and Ben Chapman on how are we going to revamp food safety training, incorporating behavioral science and learning principles. We need both. And how are we going to do this? So a lot of stuff you're going to see today is based on, I love this book from Frank Yanis, Food Safety Equals Behavior. So I'm going to display some of those techniques in there, as well as a knowledge translation scientist. The gentleman's name is Will Tallmeyer, and he's an expert in learning principles and learning science as well. So a lot of these examples I'm going to share. But one thing I think we miss as food safety professionals when we're actually doing the training is, do we ever talk to our frontline staff? Do we ever develop a needs assessment? What exactly is it that they're looking for? And how would they like that training to be delivered? Well, I did that, and I did a study a while back, and what I wanted to do was go to the frontline staff, go to people that are working on the front line in restaurants, and actually ask, what is it that they need? It was amazing that the overwhelming response was a course that was short and completely hands-on. And so I embarked on my study doing that. And I'll show some pictures of some of the work I've done previously. And I also want to invite you, I've been working with AFTO, and Stephen Matternock's been instrumental in helping us out. Both myself and a PhD student, Lindy Wiedmeyer from the City of Milwaukee Health Department, we're embarking on a study coming up. This year we're just doing some logistics. Next year we're going to embark on the training itself. And should any of the health departments or any of you want to be involved, please, by all means, I'll have my email address at the end here. Just let us know. And what we're going to be doing is revamping the traditional food safety training courses that are administered currently and using learning principles and true behavioral science into these courses. And then we're going to evaluate those as well. So AFTO has been kind enough to provide the funding for this initiative. And so if you're interested, please let me know, and we'll certainly get out and contact you there. So we know that food safety is multifaceted, and we also know that it's 2 parts when you look at training. It's the knowledge retention, the need to adapt and get the knowledge required, and then it's the behavioral change. So in this presentation, I'm going to talk to you briefly about knowledge retention. How are we going to deliver the material so that folks are actually going to remember it? What are some tips and tricks? And then we're going to talk about some behavioral science, some techniques that you can employ into your training itself. All right, let's first talk about awareness. Simplicity is the ultimate sophistication. I'm going to show you this video from YouTube, and please let me know how many passes the players in white are making. And if you've seen this video, don't guess. All right, let's hope that this works out. Okay, did anybody see the grill? I know I won't be able to see from any hands or anything at all, but the point I wanted to make here is we tend to focus on one way of conducting learning events, training. We put on blinders and we miss the bigger picture. What is it exactly that we need to deliver to our frontline staff? And that's the needs assessment. That's an effective course that's based on behavioral science and learning principles, and then the evaluation of that course as well. And when you also look at, because I do have a background in health inspections, when you're auditing, inspecting, doesn't matter what facility you're doing, doesn't matter what standard or what compliance regulation or obligation you're doing this against, we seem to be programmed to try to find a nonconformity. And if we do this, we're going to miss everything else around us. So this video helps us explain what we see and what we don't see. And it's got us thinking about many other intuitive beliefs that we have about our own minds. Might just be as wrong. Can't seem to move my slides. There we go. Oh, a little too much. Okay, employee training. So we do know that there are many facets of food safety, and training is seen as an integral component in our public health system, and it's designed relatively to reduce the likelihood of foodborne outbreaks. And training and certification of food managers, this has been used as methods to reduce food safety violations in food service, temporary food service facilities, retail facilities, and so on. But when you look at the literature, it's extremely inconclusive about the effectiveness of these training programs. And how they're actually delivered, either they're online or classroom-based and so on, how many actually have a true hands-on component? Not many at all. And when you actually look at the true definition of training, you need to have, how do you do this? It has to be a hands-on component. I do recall presenting at an AFTO conference a couple of years back, and we did the hands-on environmental monitoring. I still remember to this day how to do certain swabbings and so on because it was engaging, it was hands-on and so on. But a lot of these courses that we deliver, they adapt what's called the CAP model, K-A-P. And this has become synonymous, folks, with health education. It assumes that an individual's behaviors is dependent only upon knowledge, and that mere provision of knowledge alone is going to translate into attitudes and behaviors, positive attitudes and behaviors. We know this has been criticized for its limitations. Also, when you do research in the literature, you're going to see that adult learners learn best when they're actively involved in the learning process. The retention by participants is directly affected by the amount of practice during the learning. Now, that being said, practice does make perfect or perfection, but you need something to measure this against. You need to have a good trainer. You need to have someone that's knowledgeable in food safety. And I'll give you an example. If you draw a line in front of you right now, folks, if you draw a line that's 2 inches long multiple times, how straight is it going to be? How accurate are you going to be to 2 inches? You need something to measure against. So sometimes practice doesn't make perfect. You also need to have somebody that's a good role model, somebody that has that knowledge when they're conducting that training, and you need something to measure against. And I can't stress the importance of evaluating a course at the end to ensure that you get that proper feedback. And when it comes to evaluation of courses, we tend to adopt the old school version using the Kirkpatrick model and so on. There are other ways of evaluating that are more indicative of what the literature is telling us now. All right, I hear and I forget, I see and I remember, I do and I understand. There's my little 4-year-old little devil there with his Nerf gun, but he decides to take after his dad there and throw on a bow tie. Why not? So here I just want to just deliberate the difference between food safety education, was typically what you tend to see when you do these courses, where it's education. We're providing information on the danger zone, how to cool foods properly, and all that kind of stuff, which is great. We need to know that stuff. But there's a difference between education and training. Training involves how to do something. And again, I'm going to keep reiterating this. It's technically, and it's always hands-on. I'll give you a perfect example. I play on the side. I play the violin, albeit not that great, but it's a classical violin. And you can show me a Mozart concerto and I can read it, that's fine. But unless I actually pick up the instrument and play it and have that memory playing, have the fingers adopt that memory capacity and so on, you need that touch. You need to be able to physically do this. And when I did the TV show there for Kitchen Crimes for the Home and Garden TV and the Food Network, which came about because, which was quite interesting, is my professor at the time, Doug Powell, released a paper on how many mistakes chefs were making, food safety mistakes when they were preparing foods. And I believe he got threatened a few times from them. So from there, they decided to embark on a TV show. And on this show, what I essentially did was, perhaps this is a whole nother webinar, but I went into people's homes and we did some food safety and we looked at how they prepared food and so on. And we did some training. It's incredible that you can actually relay the knowledge, but unless they do it, the mistakes that they encounter by actually doing it, it is completely different. Something as simple as using a probe thermometer to check the internal temperature of meat. You would be surprised how many times that this was encountered wrong. Although they knew the knowledge, they were unable to actually accomplish that. The other thing to consider as well is English as second language, right? There are a multitude of factors to consider in terms of food safety training. Who's your audience? How many ESL students are present? How many millennials are there? And how many have been out of school for 30 plus years? That's extremely important. So you have to keep things simple and to the point. You have to understand the concept and apply it in real life situations. That is paramount. And when it comes to retrieval in real life situations, I'm going to come back to this point when I talk about learning principles shortly. If you decide to start throwing out complex terms, these concepts are less likely to be understood and you're going to lose your audience completely. And you have to also remember when you're conducting this training, a lot of people are shy, especially individuals who've been out of school for 30 years, and they're going to rarely ask for clarification during the course. So keep that in mind. So when you are, and when I've done my food safety training, for instance, I had a lot of English as second language students. And one thing that I saw was you really need to make thoughts and concepts visible through pictures, drawings, and practical reinforcement. That was absolutely paramount. The less words you saw on the PowerPoint, the better it was. And at one point, we completely scratched PowerPoint right off, and we did everything hands-on, using more compelling things, more compelling pictures, posters, different little techniques we employed, which I'll get into shortly when I show you some of the presentation of what we did for an event here in Manitoba. The other thing that seems to upset me a little bit is a lot of training courses are too long. They typically run 8 hours in length, 6 to 8 hours in length. Some of them are actually 2 days long. The average adult teenage attention span is extremely short. The brain goes into complete auto shut-off if it's not given something to stimulate it. You have to keep the brain stimulated. This message is for all teachers to design learning activities that require involvement, interaction, and problem solving. Because honestly, sometimes this stuff does get a little boring, but you have to be able to effectively deliver the course. It's not about time. It's about being effective, engaging, and compelling. If we're going to make any change in terms of training and in terms of food safety knowledge and behaviors, this is one thing we need to look at. I remember seeing this, it was a study, and it was a study on knowledge retention, and it was a study on microlearning. And there were two videos, two YouTube videos, and one video that was beautifully professionally shot with bells and whistles and so on how to, I forget what it was. Let's say how to paint a wall, for instance. It was 10 minutes long. Comparatively, there was another video, handheld camera, no bells, no whistles, no nothing, 2 minutes long. Which one do you think had the most views? It was the latter, 2 minutes. Because everyone's time is precious, and you have to also remember you cannot overload the worker memory capacity. Humans can only remember so many things at one time. 20 years ago, it was 7, which is why our phone numbers were 7 digits long. And a study from Harvard, the channel capacity they're saying now is 5 things, because we're always bombarded with things like electronics. You know, our capacity to retain is so minute, and there's so many things pulling at it. In fact, how many right now are actually staring at their cell phones as I'm speaking? That's normal, because we have so many things pulling at us, and everyone's time is extremely precious, which is why I should probably continue my presentation, because I'm Italian and I like to talk a lot. So let's keep going. So again, a lot of this stuff I'm going to talk about food safety behavior is I've taken a lot from Frank Yanis's book, and cause I thought it was a brilliant book, and we've employed some of these techniques and they seem to work well. This is a picture of Mason Jones. Anyone that has children, this will definitely pull on the heartstrings. He died at 5 from HUS. It was a butcher that supplied meat. There was horrific breaches of food safety hygiene, and ate a hamburger and died of HUS. Sometimes you need to put a face to the story. As sometimes, I mean, it can get graphic, but it's been shown in behavioral science techniques that a lot of graphics invoke emotion, and those emotions will actually stick, and you'll have those memory traces in your brain to actually remember certain things. So as opposed to always relating high statistical numbers, like how we've got millions of people that are sick from foodborne illness every year, this, that. No, people are not going to remember those stats. You need to be able to relate to people. So the power of one, as they call it, is extremely, extremely important. I remember going, I'm not going to continue on, because if I continue with my stories, you guys will never get off, and I'll just keep going. But I do have a story when I was doing inspections, public health inspections, restaurant inspections. This one restaurant knew that I was always coming back. They were just experiencing a number of different problems and so on. And they knew that I had thousands of restaurants I needed to inspect on this strip. That one day I stopped there and I said, you know what, I'm going to take my full day and I'm going to stay with you and we're going to do this together. Completely made a world of difference. So you scratch my back, I scratch yours. That type of mentality. And I can't relate what a massive difference that made. All right, humans are complex. There's no question there. So through the use of right certified equipment, and we can design things of sound quality, many facilities are still able to they're able to significantly reduce food safety risks. But guess what? There's always that one rogue element. That's us, humans, regardless of how our sanitary environment is. They're still going to contribute to the greatest risk to food environments, which is why the training is so imperative. The prescribed solution is to mitigate this risk is to ensure that individuals are given the time, the tools, and the training that's necessary to facilitate proper food handling practices. We're dynamic. It's as simple as that. We don't simply do what we're told, and we can't be programmed like a computer to perfectly perform all the time. Only by effecting change in food handler behavior will we be successful in embedding food safety within an organizational culture. Everyone is different, and a one-all be-all training platform is not going to work. As I mentioned a little bit earlier on, there are two facets to training. One, knowledge. You need to be able to have that knowledge, and you're going to need to be able to retain that knowledge. And secondly, of course, more importantly, is the behavior that's associated with it. I mean, I've seen many food safety training courses. I've revamped many food safety training courses. I've asked to comment on many. And the one thing that seems to be, I'd say, lacking is we are the food safety experts. Fair enough. We have the material. We have the content. We are not instructional designers, and we are not psychometricians. So when you look at the content, you have to be able to design it appropriately. That's going to be effective. And when it comes to developing questions for your exams, you have to be able to know what psychometrics are. You're going to have to be able to evaluate. You're going to have to be able to write proper questions. So as the experts that we are, we sometimes need a little bit of help when it comes to the training and learning perspective, which I'm going to get into right now. So when it comes to learning, which is extremely important, there are three phases of learning. We have to remember learning is not a one-dimensional process, and it's not a one-time event. We can't use learning as a one-time event like we do with food safety training courses. We deliver the course, that's it, and then we move on. That's a one-time learning event, and that's not effective, and that's not going to work. Learners need different cognitive supports when they're new to material. So if you look at the bottom here, number one, building understanding. The most important thing we can do here is support the learners. Do not overload the working memory capacity. You need to keep things short, sweet, and to the point. No fluff. And if the material is not important to what your objectives are, delete them. You don't need it. Spacing effect has, again, this is difficult doing these virtual webinars because I can't see any hands or anything. If there's one thing I want you to leave with today's webinar, and when it comes to learning concepts and learning science, is the spacing effect. It is the most important thing, which I'm going to get into very shortly. You need to break down your material into micro lessons. You need to assist your learners in testing their knowledge. Retrieval is extremely important, and provide working examples. Once you get that, you need to support the retrieval. Number two, after our learners, we get the basic concept, then we can provide them with retrieval practice to increase the likelihood that they're going to be able to retrieve that information in the future. It's only after, by the way, our learners attempt to retrieve that information, then you provide the feedback that's necessary. This is a very important point. The best retrieval practice events are designed to mirror future retrieval situations. Real-world practice and high-fidelity simulations are powerful because they utilize realistic retrieval practice. The higher the level of authenticity in our retrieval practice, you guys, the better the long-term retrieval. So you need to be able to do this as best as you can in a work environment. It makes a huge difference. And then finally, number three, fluency. It's important that learners are fluent in being able to retrieve the information from memory when we give them the additional practice to automate the retrieval. It's no different than when I'm ready to play a concerto on the violin in front of a crowd. Everything has to be memorized. So I utilize all these techniques, the spacing effect, perform, and sometimes I go and practice there. It makes a huge difference. All right, moving on. When it comes to knowledge retention, as I mentioned earlier, this is the one thing I need you to take away, the spacing effect. I'll give you an example. How many of you folks remember your mom's birthday? You probably do, and it's probably there in your memory. Now, how many remember your mother-in-law's birthday? Well, now you're going to have to start digging a little deeper to try to remember that, right? The one way to utilize spacing is to change the definition of a learning event to include the connotation that learning takes place over time. Real learning doesn't occur in one-time events. And if you look at the slide here, the spacing effect is one of the oldest and best documented phenomenon in history of learning and memory research, and it still holds today. I can't describe how many papers are out there, and there are many companies out there that conduct training, not necessarily food safety, but what I've seen is more in the realm of health and safety, and they're utilizing this. They're doing everything they possibly can to utilize the spacing effect. So what is it? When we talk about this, we're talking about spacing repetitions of learning points over time. It occurs when we present learners with a concept to learn, let's say the danger zone, for instance. You wait some amount of time, and then you present the same concept, but you present that same concept again. It can involve a few repetitions or many repetitions. So it's presenting these points over time. So if we were to have micro lessons, for instance, and we were talking about the danger zone 2 weeks ago, if I'm going to reiterate, or if I'm going to start up again and do another topic on food safety, I'd start again with the danger zone to keep that spacing in line. And when we're talking about repetitions of learning points, it doesn't just necessarily have to be where it's got to be through the PowerPoint or it's reiteration through verbal. No, you can have verbatim repetitions. You can have paraphrased repetitions. You can change the wording slightly. You can do this in stories, examples, demonstrations, illustrations, metaphors. The sky is open. You can actually do the spacing effect using testing, practice, exercises, case studies. Case studies are a great way of doing it. Role playing, discussions even debating on something. Should the danger zone be this? Should the danger zone be that? What about this certain bacteria? Does it grow at this level? You debate and you start creating that conversation, but you're also implementing the spacing effect on the back end, right? So dialogue, collaboration. And the repetitions can be delivered to different perceptual modalities like visual, auditory, olfactory, kinesthetic. I mean, we work with our hands and through different media as well. It doesn't have to be PowerPoint. It could be an audio. It could be video. It could be anything. Regardless of how you want to repeat, if two or more presentations of the same learning point are repeated with some sort of delay between them, they're likely to produce this spacing effect. And we found that the longer the spacing, the better it is. So let's get creative, folks. How can we do this? How are we going to be able to implement this spacing effect? And this is stuff that both Lindy and I are going to be working on when we're revamping certain food safety training programs. But how do we do this? Let's be creative. Those sanitarians, health inspectors, when you're going out doing inspections, this is a perfect time. You can reiterate certain learning points that they may have taken during a food safety training course. Those in manufacturing, Gemba walk, it's a perfect time to reiterate. Let's say you're in a manufacturing facility and you need to remember what your quality policy is, for instance, or your food safety policy. Well, you know what? Gemba walk is a perfect time you can actually do that while you're interacting with employees and so on. You can do these little micro lessons and it'll make a vast difference. So moving on here, if you look at this slide here and you look at this graph, you'll see on the left the projected forgetting curve after a learning event. So you learn, you take the course, you're at 100%, you remember as much as you can, because why? You crammed. It's exactly what we do in university. You cram for the exam, you're solid. You can see that eventually over time, your knowledge retention goes down. But if you look at the first reminder, second reminder, third reminder, and so on, you'll see that you're actually going to be able to retain that knowledge a little bit longer and a little bit more because you've been implementing the spacing effect and you're repeating certain things, certain learning points over time. Learning is not one-dimensional, and learning does not take place only one time. You have to repeat these. Otherwise, it's simply not going to work. We have two types of memory, short-term, long-term. If you want to have a long-term memory of an event or permanent storage, you need to be able to employ the spacing effect. So I keep talking about this as if it's God, right? But the literature really supports this study and really supports this phenomenon. But why does it work? What causes it? Why does it work? Well, there's three things. Wider spacings, which have been shown to be better than narrow or short spacings, they require extra cognitive effort, and this effort creates stronger memory traces and better remembering. You know, when you're trying to remember, for instance, somebody's name from a long time ago, you encountered them during an interaction, and you're just trying to remember their name, and you keep thinking about it, and then finally it clicks in. You got it. Well, now you just created a stronger memory trace. And for you to try to forget that is going to be a lot harder. The wider spacings also create memory traces that are more varied, and narrow spacings create multiple retrieval routes that aid in remembering. And the best part is it produces more forgetting during learning, prompting us to use different and more effective encoding strategies in our brain that aid in remembering in the future. So you can see here on this graph, the primary learning events, they're depicted on the left, and the on-the-job experience is depicted on the right. When we provide spacing repetitions on the job, the forgetting curve becomes a learning and forgetting curve, creating those memory traces that you really want, okay? It's extremely important to incorporate this, even on the job learning. Now, I think we're gonna do a little quiz, if that's okay. And this is where I'm probably gonna need Amy's help. I'll read this out and then go to the multiple choice question. So an instructional designer wants to develop a course for food safety managers. 15 hours of class are required. Which schedule of learning will produce the most highly skilled presenters? Polls open.
Okay, Robert, we have about 50% of people voted. Do you want me to close the poll, or would you like to?
Yeah, that'd be great. Yeah, for sure.
Close the poll?
Yes.
All right, and I can share the results if you would like.
That would be awesome. Thanks, Amy.
There you go.
Okay, I can't see the results, but
Okay, we have about 4% on A, 22% on B, 44% on C, or 44% on C, 5% on D, and 25% on E.
Right on. Okay, thank you so much, Amy. I appreciate it. So it is C. The person whose learning is spaced more widely over time will be able to better retrieve the information from memory and hence perform the best. Going on to the next. Who's better looking? Oh, okay, no, let's skip that. Okay, question. A food safety course is offered online. Lessons are designed to follow up on previous lessons. There are 8 in total. When 6 months have passed after successful completion of the course, which of the learners will remember the most?
And the poll is launched, so go ahead and choose your answer. Okay, we have about 50% voted, but answers seem to still be coming in, so I'll just wait till they slow down a little bit.
Right on.
Okay, it looks like answers have slowed down. I'm going to close the poll and share the results.
Great, thank you.
All right, we have 12% for A, 42% for B, 41% for C, and 5% for D.
Right on. Thanks so much. The answer is actually C. Those who worked on the course every other week or so when they got a chance completing the course in 4 months. B is a great answer as well, but C would be the answer we're looking for here. But thanks everybody for participating. I appreciate it. All right. Power of storytelling. Do you remember at the beginning of this course, I started off with once upon a time, for instance? So academics have found that our brains are completely hardwired to process and store this information in form of stories. So when you hear that once upon a time, there was a certain character in such a place, or our minds are immediately transported into this imaginary scene. So we are completely hardwired to tell stories and enjoy stories. I cannot iterate this enough. When we're doing our training, the more stories you have, the more your learners are going to actually listen. And when you look at now TED Talks, for instance, a lot of CEOs of companies, when they're using PowerPoint, the PowerPoint is simply a means of supporting the speaker. The speaker is the star, but you need to be able to relate those stories. You need to immerse your audience in the story. That's when you're actually going to start listening. I remember I did that when I was doing my master's degree under Doug Powell. I remember I had to give, it was something on pasteurization, and it was a technical report on pasteurization, and I started just blabbering away with all the facts and listeria and this and that, going on and on. Finally, I just reiterated a story of when I used to work in the laboratory and when we did receive samples of raw milk, for instance, and what we did encounter and how many people were sick. And it was at that point he said, now I'm listening to you. And I still remember that to this day. And when I'm giving presentations and I'm blabbering away, the more stories you have, the more stories I have, the more they're going to actually listen. So tell a personal story. This is why when we do offer food safety training courses, we need to make sure that whoever's conducting these courses have the necessary background to know the material well enough to tell stories and actually have their own stories, because it's going to be compelling and it's going to be engaging to your audience. So bring these characters to life. We have to be able to share those, and they'll start listening at that point. All right, getting into a little bit more now of the behavioral science part of it, principle of consistency and commitment. It was a famous psychologist, Cialdini. He said, people want to behave in a way that is consistent with their values, beliefs, and commitments. If a person has stated their beliefs publicly or a written commitment, their ideas, behaviors will be consistent with that. Why? We're human. Inconsistency is a socially undesirable trait. So one example that was given, and again, this is from Frank Yanis's book, that I thought was quite interesting was decreasing restaurant reservation cancellations. A restaurant was experiencing 30% cancellation rate, and they just couldn't seem to get a better rate. And they were just always frustrated with this. And whoever answered the phone would politely just say, please call if you change your plans upon a reservation. Nothing happened, 30%. So then they used a little bit of behavioral science and they added, will you please call us if you're going to cancel, with a pause. This now forces the other person to make a commitment, either yes or no. And when that occurred, something as simple as that, they saw a massive increase or decrease in their cancellation rates just by using that in itself. And I remember when I was doing my TV show, they stressed the importance of using pauses. You need that commitment, and then that will make a huge difference. I actually did it on my wife. I shouldn't be doing this, but I did. I asked her, I said, I tried this out. I said, can we have steak tonight? I love steak. And she, no, because she thinks I eat too much red meat. Fair enough. So then I said the other day, I said, okay, let me see if this works. Will you let me have steak tonight? And I paused. She said, no. So it obviously didn't work on her, but okay, but you get my point. It will, and it does work. And we've seen this proven in the literature as well. It's the same thing when you look at once people commit, it doesn't matter how, if they commit verbally or in writing to a smaller request, for instance, they're much more likely to comply with a larger request. So these scientists, behavioral scientists, psychologists decided to test this. So they had two groups. One group went into a neighborhood and they asked the residents of a neighborhood if they would put this massive, ugly, poorly lettered sign on their lawn saying, drive carefully. 83% said no. Now, same group went back, asked the residents if they were willing to put up just a small little 3x3 sticker saying, be a safe driver on their front window. Most complied. 3 weeks later, that same group went to the houses with a 3x3 sticker and asked, will you allow us to put that same big, massive, ugly sign on your front lawn? 76% of those with the signs complied. So the compliance went from 17% to 76%. Why? Because you forced that commitment. And humans want to be able to, they want to be able to behave in that way, and they want to be able to be consistent with their values, beliefs, and commitments. So they're going to do it. The next one I want to just briefly talk about is the social norm. If one person is standing on the street corner, we've all seen this, and they look up, they say about 40% of individuals that walk by, they'll do the exact same thing. Now, if you put multiple people in the corner, like you see in this picture here, 85% will look up at absolutely nothing, because the tendency is for humans to mimic each other. It's the social norm. And this is why we keep saying, especially when we were doing inspections and audits and so on, you need to create a food safety champion. You need to have somebody there that's going to be able to influence others and do that. Another example to principal social norm, when you're conducting your training, make sure you're using pictures applicable to whoever you're training. So let's say, for instance, you're training students at a university. Make sure that in your training, you're using pictures of their university. You're using pictures of their shirts that say, let's use Michigan State, for instance. Their shirt says Michigan State. You're actually using real pictures. The social norm principle will apply, and they're going to be able to interact, and they're going to be able to engage a little bit more. They did a study with hand washing, for instance. We've all seen those hand washing signs. Please wash your hands after leaving the restroom. We've seen this many times, and there's different modalities, different ways of doing it, and so on. So they wanted to test this, actually. It was at Michigan State University, where they actually had an individual wearing the Michigan State colors, washing their hands in a photograph, saying, please wash your hands. Compliance went up dramatically. So just something as simple as that. So those of you that are in manufacturing, retail, whatever the case is, make sure that in your training, you're using pictures that are applicable to your work, your place, that are going to engage your trainers. Next, something as simple as this. This is the letter F, obviously, but if you look at the bottom, that line at the bottom of the F is called a serif. It's incredibly simple, but it's been scientifically proven that by using a serif on the letters makes it easier to read, and learners are not focused on reading the content, but they're focused on the intent of the material. So they're not concentrating on reading, they're actually absorbing the material. Something as simple as a serif on a letter. So whenever I'm writing SOPs, whenever I'm writing food safety training manuals or food safety materials, I use a serif. What does it cost me? Absolutely nothing. All right, moving on. Power of why. This is extremely, extremely important. This is why I keep saying when you're delivering a food safety training course, you need to ensure that the instructor is very knowledgeable in the material, that they know microbiology, they know the principles of food safety. They're abreast of the new and emerging situations in food safety. They need to be able to have that information, and they're going to need to be able to explain why. I can tell people you need to use a thermometer to test the internal temperature of food products. That's insignificant. It's not going to do anything. You need to be able to explain why that's important. So a study that was conducted in Harvard actually proved this point in itself. Researchers went to a library at a time when there was a massive long lineup at the copier. They cut in front of the line and they said, hey, listen, can I cut in front of you? 60% said, yeah, sure, go ahead. Now, they did the same thing again, and they said, can I cut in front of you because I'm running late? 94% let them cut in front. Then finally, they went back again. They wanted to test their assertion, and they said, can I cut in front of you because I need to really make a copy of something? 93% said, yeah, go ahead and cut in front. The point here is it doesn't matter how weak your reasoning or your why is, it increased the compliance. So that's the same thing when we're delivering the training. Be cognizant about this. When we're talking about certain things like danger zone, temperature, this, that, we need to be able to explain why it's important. How is it going to affect them personally? What is it going to do to them? And not just in, let's say they're working in a retail establishment, not just in a retail establishment. What about at home? What about if they have kids? Like, what about certain things? We need to explain why certain things are important. And the more ammunition you have to explain that why, better it's going to be. Case studies. Case studies are very important. Case studies will help iterate the spacing effect. So this is one way you can do this. So you can present material at a training course. Then in 2 weeks' time, give them a case study. Something very simple, nothing too complex. But what's really important here is give a case study that actually shows or displays mistakes. Like for instance, in a foodborne outbreak scenario, we're going to give a case study on a foodborne outbreak scenario. What went wrong? Let's discuss all the mistakes that had occurred in that scenario. What did that manufacturing plant, what did they not do? Like, what was it? What were the breaches of hygiene? What was it that they didn't do? So you want to be able to explain the scenario using mistakes. And they actually did a study again, and it was a mistake. They did a case study. It was with firefighters, 2 groups. One group, they received a scenario with mistakes, resulting in a horrible, tragic consequence. And group 2 received the exact same case scenario presented without errors. Then they were given a whole new set of different scenarios, the exact same one for both, without any mistakes in it. Who do you think outperformed? It was actually group 1, the one that received the scenarios with the mistakes resulting in tragic consequences. They statistically significant results outperformed the second group in itself. So the point here is whenever we're doing training, use real life examples of outbreaks. What went wrong? What were the consequences? Use the scenarios and talk and make it into a story. Make it as compelling as you possibly can. We know with lighting, what do we typically see with lighting with food safety? Well, we need to know the illumination has to be bright enough, light bulbs have to be shatterproof, it prevents crime and so on. But lighting is extremely important as well when you're delivering a training course. Why? Again, I'll discuss another quick study that was conducted. 2 groups. One group, they had 20 problem math. They had a 20 quiz math scenario, or 20. Let me learn how to speak properly. They had 20 questions, math questions. Second group, same questions. One group was placed in an area with inadequate lighting. The second group with lighting. And whenever they got a right answer, they were compensated with money. Now, they had to self-mark their quizzes. And the researchers had a way of actually seeing what they were actually marking and were able to get the answers themselves. So who do you think lied? The group with inadequate lighting or the group with lighting? The group with the inadequate lighting lied 61% as opposed to the group 2, which was 24%, which was in bright lighting. Why? Because inadequate lighting, when it's darker, you tend to hide certain behaviors. You think you're going to get away with certain things. So lighting is extremely important when you're doing food safety training or in your retail store or food service establishment and so on. This is often what I tend to see this when I'm looking and when I'm evaluating food safety training courses. You have to be able to realize that we need to not only rely on learning principles and behavioral science. It's incredible what marketers can possibly do and advertisers. The amount of behavioral and psychology that goes into their programs and what they're developing is absolutely immense. You always want to position images and graphics on the left. Why? When you perceive stimuli toward one side of your field of vision, the opposing hemisphere processes that and vice versa. Your right hemisphere on the right is better suited to process pictures. And the left, well, it's more logical, more verbal. So it makes more logical sense to have pictures positioned on the left. So if you are going to have a PowerPoint presentation, or if you are going to be doing food safety training and you're putting up pictures and there's verbiage and so on, make sure that you align your pictures to the left. Something very simple to do, but it's a little trick and tip that you can employ. Encourage mental interaction. You have 2 cups in front of you right now on the slide. Which one would you rather grab? When the handles are facing the right, as you see the one on the right here, people mentally interact with that product because it's the dominant hand for most people. So same thing with food safety training. If you're going to show somebody using a thermometer, make sure you have someone holding it in their left hand facing you. You want to be able to mentally interact with that image, right? So the dominant hand for most people is right. So by seeing this image here, you can almost see yourself grabbing that cup. And same thing with this picture here. This encourages mental interaction. You have somebody actually holding up the book, right? It encourages that mental interaction. You want to orient your gaze towards your call to action, it's called. Now, the other thing that and a lot of folks do this as well, which I think is fantastic, is neural encoding. Oh my goodness, I'm running out of time. I apologize. This is extremely important. Rhyming your slogans, right? Rhyming is extremely important. Your food's out the door if it's above 4 and so on. People will remember these techniques. And so we've done this as well in our training as well. These are just some pictures that I've taken. I'm going to go through them quite quickly just to show you what we've done for a temporary event here in Manitoba and what we're planning to do as well with the AFTO funding when we're doing and revamping food safety training programs. So we've made everything extremely hands-on. So we have different stations within the kitchen, station 1, 2, 3, 4, 5, 6, 7, 8. You can see station 4 here. This is all food temperature control. Another station on sanitation, personal practices, and we employed every different behavioral technique that you can possibly put in, including identifying mistakes, thinking outside the box, posters, engaging videos, interaction, moving. It's something as simple as moving to one area to the next will make you remember a certain image. Little tricks and tips like that. So I'm just going to go through these a little fast. At the end of this presentation, you'll have my email address there. By all means, feel free to email me with questions, concerns, or if you want to dig a little deeper into what we did with this training here. Like this picture here, for instance, we deliberately made mistakes. So instead of looking for the proper things, you had to identify the mistakes and what mistakes were there and so on. So, and we also did it for a retail establishment as well. And we did it not in a kitchen, but we actually created a kitchen in a room. And you can see some of the pictures here as well. I won't get into the survey here. And again, a big thank you to AFTO for providing the funding for myself and Lindy. We plan to conduct the training next year. So again, if any of you are interested in being a part of this program, and we're going to evaluate and determine compliance, please email me, give me a call, do whatever you need to do. Just remember I'm in Winnipeg, Manitoba, so I'm on Central Time, so be cognizant of time difference. Aside from that, I'm more than happy to entertain questions. I know I did go a little too long. I do sincerely apologize about that, but I am Italian and I do like to talk quite a bit. I can't really control that. So if we don't get to the questions, please feel free to email me your questions or call me. I'd be more than happy to discuss behavioral science and learning principles with you. And a big thank you once again for attending this. I very much appreciate it.
Great. Thank you, Robert. We actually do have some questions already in the question box. Do you have some time to hang around if the questions go a little bit over?
I do have a couple of minutes. I do have a call
Okay.
coming up in 5, so I do have some time I can entertain.
All right. The first question is, what are your suggestions when training a food safety course that is designed by another company, i.e. serifs, where the exam is based on knowledge rather than application?
Yeah, and we've come across that problem here in Canada as well, where the knowledge is based. So typically, in a situation like that, what I've done is, so I can tell you what we did here in Canada for sure, is I have access to the questions. We know what the questions need to be based on. I don't agree with just simply having just retrieval practice is important. So you do need to have some sort of quiz, test, retrieval way of see whether or not the learners understand the material. That's one way, but you also need to assess the practical component of it as well. So what we've done here is we've taken a course and we've completely modified it, whether it was something similar here in Canada to ServSafe. I'm very familiar with ServSafe, but we've taken that course and we've modified it. The content is still there, but we just made it completely hands-on. And yes, there is a component. You can't get away from PowerPoint as much as I've tried. You can't get away from the PowerPoint. You need to have a certain amount of that PowerPoint. Doesn't mean you can't be compelling, and it doesn't mean you can't be engaging, and it doesn't mean you can't add your own videos and fun stuff to this as well. So what we did is we kept it shorter. So we've taken what really needs to be on PowerPoint that you can't really do hands-on, and we've adopted the rest to make it completely hands-on while still covering the material that needs to be covered for the exam. And that seemed to have worked well.
Great. Thank you. We will ask one more question and then we'll let you run off to your call. How will you be adapting your hands-on training with COVID precautions?
I knew that question was going to come up. So we're hoping what we're going to do is the training is not going to commence this year. The training is going to commence next year, and I'm hopeful that there are going to be protocols in place. We can't get away from not doing hands-on. If we really want our learners to know the material and to truly understand it, you need to have a hands-on component. So we'll make sure that we have protocols in place that if we are and when we do the hands-on training, that we're going to try to abide to the COVID rules that are necessary in terms of sanitizer, this wash your hands, and so on. But this is why the study was actually conducted. We were going to conduct the study this year. And we had a few participants that wanted to join in, one in the United States, one here in Canada. And we decided to postpone it until next year until this whole COVID pandemic slowly goes away. Now, if you are entertaining the fact of doing online courses, again, it doesn't have the practicality component to it, which to me is absolutely vital. You can still take that course and adopt behavioral science and learning principles in that fashion as well. You just have to be a little bit more creative.
Great. Thank you so much for your time, Robert. We really appreciate it. There are several comments in the question box thanking you for the presentation and saying that it was very well done. So we really appreciate you taking your time to teach us about this. And this webinar is being recorded and it will be posted on the After Professional Development page for later review. So thank you again, Rob.
Thank you, Amy. I appreciate it. Bye-bye, all.
We hope you all have a great day.